Good day everyone, I am Maribel Makatangkad and today I am going to talk about marriage. Marriage is a legally and socially sanctioned union, usually between a man and a woman, that is regulated by laws, rules, customs, beliefs, and attitudes that prescribe the rights and duties of the partners and accords status to their offspring. This institution of marriage as a useful social factor is being challenged in our times. It is possible that there never has been a time in history when so many people entertained the thought that marriage is obsolete. There are numbers of contributing factors to this growing concept that marriage is losing its usefulness. So, let's talk about the preparation for the marriage relationship. After a person has decided to receive Jesus Christ, the greatest decision ever to be faced in life is the selection of a lifetime partner, a husband or a wife. I cannot stress too strongly that choice of your mate in marriage is of the gravest concern. No Christian should never attempt marriage without prayer and a thorough search of the scriptures. Now let me discuss the precautions of marriage. The first precaution: a Christian should never under any circumstances marry an unsaved person. The Bible forbids a believer in Christ to consider marriage with an unbeliever. Mixed marriages are never countenanced by God in either the Old New Testament or the New Testament. No two persons can live in harmony except they are in agreement on life's most important choice. If the one person has received Jesus Christ as the Lord and Savior, and the other has rejected Him, there is no common ground on which to start a marriage. Let's proceed to the second precaution. A Christian should not marry merely for sexual gratification. The marriages that are based on sex alone are not happy marriages. Young people in their teens should heed this counsel. In a normal person, the psychic energy usually associated with the sexual instinct moves in cycles. It strikes first when we are in our teens, and at such an early age, no person is mature enough to assume the responsibilities of marriage. Those first sex drives create a difficult and dangerous time for young people. It is an easy matter for any teenager to be carried away by an infatuation for a person of the opposite sex. Too often, such an unreasoning and uncontrolled passion has been mistaken for love, and this in turn has resulted in broken marriages. Now let's proceed to the third and the last precaution. Do not decide upon marriage as an escape from pressure. So now let's move on with our next topic, which is the 7 basic marriage types. Families naturally clustered into 7 distinct profiles according to David H. Olson. The first type is devitalized marriage. There are pervasive unhappiness with all relationship dimensions and considerable instability. Both partners have considered divorce. They are critical of each other's personality. Their marriage is strictly utilitarian. They tend to be a younger, married a shorter time, and have a lower income than other couples. Many are minorities. More of them come from divorced homes, and more of them were previously divorced themselves. They stay together for lack of alternatives. The second type is the financial marriage, or the financially focused couples. These couples have conflict and are unhappy in their communication and the way conflicts are resolved. They are dissatisfied with the personal characteristics of their partner, and there may be bitter personal attacks. Their careers come before the relationship, and money or financial rewards hold them together. Their single relationship strength is financially managed. A high number of husbands and wives in such utilitarian relationships have considered divorce. The next type is the type number 3, which is conflicted marriage. They are dissatisfied in many phases of the relationships: personality issues, communication, conflict resolution, and sexuality. And they may avoid or fail to settle issues between them. Instead, they focus on and gain satisfaction from outside experiences, such as the leisure, the children, religious life. But a high percentage of both partners have considered divorce. Next, the fourth type, which is traditional marriage. They are moderately satisfied with many relationship elements, with their sexual relationship and the way they communicate as are sources of distress. They are not as critical of each other's personality as types 1, 2, and 3. Their strength lies in a satisfying religious life and good interaction with extended family and friends. The marriage are relatively stable. These couples tend to be older, married longer, white, and Protestant. Next is the fifth type, which is the balanced marriage. They are moderately satisfied with most relationships areas, with real strength in communication and problem solving. The biggest problem is the financial management. They have a higher than average agreement on leisure, children, and sexuality. They place a high value on the nuclear family. Still, over a quarter have considered divorce. Next type is the sixth type, which is harmonious marriage. They are highly satisfied with each other, the expression of affection, and their sexual life. But they are self-centered, viewing children as a burden and parenting as a source of distress. It may be that when a problem develops in this family, it shows up in the child. Now we are down to the last type, which is the seventh type, the vitalized marriage. They are highly satisfied with almost every dimension of their relationship and get along well. They are personally integrated, have strong internal resources, and agree in most external areas. They develop difficulties but resolve them well. They are economically better of the most others and tend to be older, married longer, white Protestant. They tend to be in their first marriage and come from intact families. So married people are both responsible for and responsible to another human being, and both halves of that dynamic lead the married to live more responsible, fruitful, and satisfying lives. Marriage is a transformative act, changing the way two people look at each other, at the future, and at their roles in society. So that's all for my topic. Now, I'm going to pass the floor to Miss Alice Ashana.
Greetings to everyone. Let me discuss to you about abortion. Abortion is a procedure of terminating a pregnancy by removing the fetus or embryo. Nearly 26 countries do not allow abortion without exemptions. In some countries, it is permitted only to safeguard the mother's health and save her life. There are actually different types of abortion. Depends on the trimester and the child barriers medical condition. This includes we have the six type of abortion, which are medical abortion, suction abortion, D&E, induction abortion, late-term abortion, and the last one is the spontaneous abortion. Now, let me discuss you the first one, which is the medical abortion. A medical abortion is done with the help of two abortion pills. We have the mifepristone, and the misoprostol pills. Alright, so when we say mifepristone is a drug that blocks a hormone called progesterone that is needed for a pregnancy to continue. Mifepristone, when used together with another medical pill called misoprostol, this end the pregnancy through 10 weeks gestation, 7 days or less since the first day of the last menstrual period. In the other hand, today the information of misoprostol, this used to elective medical abortion, cervical opening before surgical abortion. evacuation of the uterus in case of death, and induction of labor. The drug may also be used to treat and even prevent postpartum hemorrhage. At the end of it, these pills needs to be prescribed by your doctor and is illegal to sell them over the counter. If it is less than 11 weeks pregnant, the doctor might suggest to get medical abortion. And the benefit of medical abortion is that it doesn't require any anesthesia or surgical procedure. Medical abortion is not recommended for people who have anemia or serious blood clot problems. Also, people who are allergic to the prescribed medication, the IUDs, and fetus implantation outside of the womb. So taking the abortion pill at home, make sure to ask the doctor for proper directions on how or when to take the pills. So alright, so that's all for my part, and the rest will be discussed by my group mates. Thank you for listening. I hope you've learned something.
Here's the another type of abortion. We have the suction abortion, or also known as a vacuum aspiration. The procedure is allowed to terminate a pregnancy that is in between 12 and 16 weeks. It uses gentle suction to empty your uterus. In certain cases, suction abortion is prescribed when medical abortion fails. In this scenario, the surgeon might need to dilate the cervix for easy access. Suction abortion is not suggested for people who have a uterus that functions abnormally or is shaped differently. Second, have a blood clot problems. And last, have a pelvic disorder or infection.
Here's another type of abortion, which is the induction abortion. Induction abortion is appropriate for those people who have crossed the 24th week of pregnancy and cannot get a dilation and evacuation or the DNE. The doctor will prescribe a pill that you need to take in the hospital setting, which will put you in labor and cause contractions to release the fetus. Induction abortion is ending a pregnancy by using medicines to start induced labor and delivery in the second or third trimester. This is done in the hospital. The doctor may also use a medicine to stop the pregnancy before induction. The induction medicines may be put in the vagina, given by mouth, or given through a vein or IV. Different medicines may be combined to make sure that the induction works, and to reduce bleeding, you will be offered medicines for pain. Most pregnancies are normal. Most women who have good care during pregnancy and delivery will give birth to a baby without problems. However, some women may have health conditions or pregnancy problems that may require special care or hospitalization during pregnancy.
Hello, good day everyone. I am Abigail Sisibugan, and now I'm going to tackle the topic of late-term abortion. So late-term abortion are generally understood to take place during or after the 21st, 24th week of gestation, which is late in the second trimester. That gestational period roughly corresponds to the point of fetal viability, or when the fetus might be able to survive outside the womb with or without medical assistance. However, there is no precise medical or legal definition of late term, and many doctors and scientists avoid that language, calling it imprecise and misleading. They say late term may imply that these abortions are taking place when a woman has reached or passed a full-term pregnancy, which is defined as starting in the 37th week. Most countries ban late-term abortions, and are only allowed to be performed in the life or health of the childbearer is at risk. Reasons individuals seek abortions later in pregnancy include medical concerns such as fetal anomalies or maternal life endangerment, as well as barriers to care that delays in obtaining an abortion.
Good morning everyone, I am Angelina Chano and I will discuss about spontaneous abortion. Spontaneous abortion by definition is that of the fetus. About 20 to 30% of women with confirmed pregnancies bleed during the first 20 weeks of pregnancy. Half of these women spontaneously abort. Thus, incidence of spontaneous abortion is up to about 20% in confirmed pregnancies. Incidence in all pregnancies is probably higher because some very early abortions are mistaken for a late menstrual period. Symptoms of spontaneous abortion include crampy pelvic pain, uterine bleeding, and eventually expulsion of tissue. Threatened abortion patients have uterine bleeding and it is too early to assess whether the fetus is alive and viable and the cervix is closed. Potentially, the pregnancy may continue without complications. Inevitable abortion. The cervix is dilated. If the cervix is dilated, the volume of bleeding should be evaluated because it is sometimes significant. Complete abortion. The products of conception are partially expelled. Next is complete abortion. The products of conception have passed and the cervix is closed. After a spontaneous abortion, parents may feel grief or guilt. They should be given emotional support and in most cases of spontaneous abortions, reassured that their actions were not the cause. Formal counseling or support groups may be made available if appropriate.
The stigma around abortion can make it difficult for people to make the decision. However, general causes of abortion might include unplanned pregnancy. An unplanned pregnancy can raise different and sometimes confusing feelings and thoughts, and this is very normal. Even if a pregnancy is unplanned, it may still be wanted. Unintended pregnancy is among the most troubling public health problems and a major reproductive health issue worldwide, imposing appreciable socio-economic burden on individuals and society. Governments generally plan to control growth of births, especially wanted births as well as orphans and illegitimate births, imposing extra burden on public funding of the governments, which inevitably affects economic efficiency and leads to the economic slowdown too. Number 2, financially instability. Economic concerns are the most commonly cited reasons women choose an abortion. There are numerous reasons why one may feel financially unprepared to be a parent. Situations that impact financial security include being unemployed, which means that you might be working but aren't working in a position that fully uses your skills or allows you to reach your earning potential. Number 3, relationship issues. There are many issues in a relationship that affect a woman's decisions to have an abortion. Marital status is just one of those. The majority of women who choose to have an abortion are unmarried. According to the survey of Well Health, 85.5% of those who had abortions were single women. For some of these women, the fact that they are unmarried contributes to their decisions to seek an abortion. About 8% of those responding to the survey of reasons of having an abortion specifically note that they do not want to be a single parent. About 5% of women say that their choice was influenced by family. This may be because they believe their family will not support them. A small percentage of women also that they were directly pressured to have an abortion by family and friends. Being in an abusive or unhappy relationship can affect a person's decision. Data from National Intimate Partner and Sexual Violence Survey indicated that 2.9 million women or 2.4% report having a rape-related pregnancy in their lifetime, and 77% of these are caused by current or former intimate partners. Other studies have shown that 1% of women disclose their reasons for having an abortion is due to rape or incest, and 50% of women who have rape-related pregnancy choose to have an abortion. Number 4, health concerns. Abortions are related to health issues. These can include concerns for the woman's health related to serious illnesses. At times, the pregnancy itself can be a high risk to the mother's safety and well-being. According to the Centers of Disease Control and Prevention's National Pregnancy Mortality Surveillance System or PMSS, nearly 1/3 of all pregnancy-related deaths occur during the pregnancy. There may also be worries about the health of the fetus after a medical condition is diagnosed during prenatal testing or due to the abuse of drugs or alcohol. Number 5, not ready emotionally or mentally. Many women think that it is
not the right time to have a child. In some instances, women may feel they are too old, too busy, or not yet ready. Similarly, some women feel that they are not yet emotionally or mentally prepared to carry a child or even handle a pregnancy. They may choose to have an abortion because they want to avoid changes to their educational plans or careers, or they want to wait until they are most settled in life.
Hello guys, I'm Lucy Dicena and now we are going to talk about the divorce. So what is divorce? So a divorce is a court judgment ending a marriage. So the court requires a legal reason for the divorce in addition to legally ending your marriage. So the court looks at other issues that need to be decided before the divorce become final. And second, is divorce my only option? So the answer is no. Because married couple may choose to live apart from each other but remain married for religious, personal, or financial reasons, or for the sake of their children. So you may decide to seek a judgment of separate support or a judgment of support. And also, a judgment of separate support can decide custody. And last, what is the difference between a divorce and separate support? So the main difference is that a judgment of divorce ends the marriage, and then a judgment of separate support does not end the marriage. So in realization, there are shockingly few divorce-related movies in this nation, where neither spouse is made into a cartoon villain or unexpectedly written out of the plot, and despite the fact that a million individuals file for divorce each year. So it's natural to get swamped by the injustice sorrow of its all when you were facing unwelcome divorce. So that's all, and have a good day everyone.
Number 4. What is legal separation? There is no legal separation in Massachusetts. You do not have to get court permission to live apart from your spouse. It is legal to live apart from your spouse. We do have separate support cases in Massachusetts. To get a judgment for separate support, you will file a complaint for support. In Massachusetts, spouses can make separation agreement. Separation agreement is a written agreement signed by the husband and wife. What issues are decided in a divorce case or separate support case? Some of the issues that need to be decided in a divorce judgment are custody of children, support of children, parenting time or visitation with the children, division of assets, for example, pensions, bank accounts or stocks, alimony or support for the spouse, division of personal property, division of debts, for example, credit cards or electric bills, taking back the name you had before you got married, and possibly an order for protection from abuse.